Hello, everyone. Welcome back to another episode of the Wake Forest Summer Immersion Program's Fireside Chat Series featuring our academic leaders. Today, I am super excited to be with Dr. Nicholas Trasolini, who co-leads our Sports Medicine Institute alongside Dr. Gary Paling. Dr. Trasolini, thank you so much for being here to talk about the Sports Medicine Institute.
Thanks for having me.
Awesome. Well, we would love to get to know you a little bit better. Dr. Trasolini is a very busy person and he has many roles and wears many hats. So, Dr. Trasolini, kick us off just by telling us who you are, what you do, and a little bit more about your day job.
Sure. So I'm Nick Trasolini. I'm an orthopedic surgeon at Wake Forest, which is now under Atrium Health. So Atrium Health, Wake Forest Baptist Medical Center, and Wake Forest University School of Medicine. And so what I do is I'm an assistant professor of orthopedic surgery. So I'm involved in my day-to-day taking care of patients, but also in education of our residents and fellows. I'm the Associate Fellowship Director for Sports Medicine at Wake Forest, which is a program that trainees do at the end of their orthopedic training after you've done medical school and after you've done residency, additional training in sports medicine specifically. And so I help to coordinate that program. In addition, I'm a team physician for Wake Forest football and other athletic activities at Wake Forest as well, but with football being my primary responsibility overall. In addition to that, I help take care of high school athletes, and I also participate in high school athletic coverage on Friday nights for some of our local high school football teams, in particular East Forsyth High School. And so there's several things that I do, but it all centers around orthopedics and sports medicine and really the goal of keeping people active.
Well, great. Thank you so much for sharing all of that. We are so privileged to have both Dr. Trasolini as well as Dr. Paling donate their time to the summer immersion program. It is very rare that a sports medicine program like this being offered to high school students is actually being led by esteemed orthopedic surgeons. So we feel very lucky. And also, if you're ever watching a Wake Forest football game, you might be able to see Dr. Trasolini on the sideline. So that is always something that's kind of fun to look out for when we're looking for Dr. Trasolini.
A
All
little bit
right,
of
so
a Where's Waldo. We all wear the same polo shirts and the same hats and the same khakis. So, um, yeah, but hopefully I'm not on the field. That means somebody got hurt.
Yeah, true. Very true. Okay, so now I would love to delve into learning a little bit more about the Sports Medicine Institute. So talk to me about what students can expect on a typical day in the Sports Medicine Institute.
Sure. So our goal with the Sports Medicine Institute is to expose the students to not only what I do, which is orthopedic surgery, but also other fields within sports medicine. And that includes things like athletic training, physical therapy, physician assistant or physician associate, as it's now called, as well as some other things like podiatry, orthotics, which are professionals that design prosthetics, and really just the full spectrum of what it takes to take care of athletes and take care of individuals with musculoskeletal conditions. And so our goal is to provide you with both hands-on and lecture-based material where you're exposed to different sides of the profession. Hopefully, you'll learn a lot about what we do, but also a lot about orthopedics in general and some of the real nuanced things that make sports medicine a team-based area of medicine in a lot of ways more so than other areas of medicine. So just to kind of summarize, we're giving you hands-on activities as well as lecture-based activities, exposure to a lot of orthopedic surgeons, but also athletic trainers, PAs, PTs, and various other fields within musculoskeletal medicine.
Yeah, so when we say you're being immersed in something, the summer immersion program, you really are being immersed during this week in the field of sports medicine. So it's a really phenomenal experience for students who are curious about what it may look like to kind of explore some of those different career pathways or fields. Um, all right.
Absolutely. We feel strongly that at the level of high school, you may not be able to commit fully to one profession, but you may have this interest in sports medicine or musculoskeletal health. And so our goal is to have you, yes, exposed to what we do in orthopedic surgery, but also to get you exposed to some of these other professionals and individuals. And we'll bring you through activities that are very medical in nature, but also some activities that are more rehab science based. Um, but all in all, certainly with an orthopedic bend, given that it's led by myself and Dr. Paling, who's a longtime and very well-known orthopedic surgeon.
Yes. All right. So you mentioned a little bit about some of the hands-on activities. And I know students also have the opportunities to go on a few field trips throughout the week. So can you talk to me, what would you say is the most exciting or unique field trip that students are able to go on during this week? And what is the most exciting and unique hands-on activity or experience that students are
Sure.
able to do?
Yeah, I think the one field trip that a lot of students find is really interesting is the visit to the Wake Forest pitching lab. And so Wake Forest baseball has been really quite good, often ranked in the top 10 over the past few years. 2 years ago, we made a trip to the College World Series where we unfortunately lost LSU, but it was a great run in the College World Series. And a lot of that comes from optimizing our pitching performance with the pitching lab. And the pitching lab is a 3D motion capture facility that's run by PhD scientists who are really trying to find out what aspects of the pitching motion, the throwing motion contribute to better performance, but also reduce risk of injury. And so you'll meet there with Dr. Kristen Nicholson and her team and learn about how that facility works. And I think that's a unique experience that Wake Forest has to offer that a lot of other places wouldn't. Additionally, in terms of hand-on experiences, you'll get practice putting on casts, something that we do frequently in orthopedic surgery and sports medicine. You'll learn about taping ankles. You'll learn about um, anatomy that goes into orthopedic surgery. And in particular, we have special experience with a cadaver lab where you get to see the anatomy hands-on, front and center, as well as to try an arthroscope, which is a camera that we use inside of joints to treat many conditions nowadays in a minimally invasive way.
Yeah, the hands-on activities throughout the week of the Sports Medicine Institute are pretty spectacular. I know students just kind of initially, when they hear that they're going to be doing a cadaveric dissection, are a little bit weary or maybe a little bit nervous. But then after the experience, after they've kind of learned from these physicians and these surgeons and kind of been able to explore. They are just so energized and excited about it. So that's always really, really cool to see. And the hands-on experiences of this institute are just pretty phenomenal because they are all led by orthopedic surgeons.
Yeah,
Um,
we're going to show you things that we talk about, things that we do in surgery, show you anatomy that we can fix surgically. And you'll really hear it directly from us and get a chance to see things hands-on and up close. For example, where's the ligament that's reconstructed in Tommy John surgery? What's an ACL look like? Things like this that you won't get in the context of your normal high school anatomy class, especially in a hands-on way. So I think it's a very unique and special thing that the Institute has to offer.
Yeah, it really is. So the Sports Medicine Institute is just one of our medical themed institutes as part of the summer immersion program. So we also, offer a medicine institute. We also offer a health and exercise science institute. This upcoming summer, we're offering a women's health institute. So Dr. Trasolini, how would you kind of have a student differentiate or decide on which institute might be the best fit for them?
Yeah, so at its core, our institute is orthopedics and musculoskeletal health. Um, there are other institutes that'll focus more on the actual college major of health and exercise science. Ours is going to focus more on the health professions within sports medicine, with definitely a focus on orthopedic surgery, given that we lead the institute, but also with exposure to athletic trainers, physical therapists, PAs, and other areas of musculoskeletal health and medicine in the professional sense. So the Medicine Institute, to my knowledge, is a more general exposure to the field of medicine overall, whereas ours really cones in on musculoskeletal medicine and surgery as well, orthopedic surgery or surgery of the musculoskeletal system.
Perfect. Yeah. So, it would be a great opportunity to maybe start, if you're unsure about where you want to go into the field of medicine, maybe start with medicine and then, or if you're already really into sports medicine or are an athlete and have been injured and have worked with some of these individuals, maybe just through PT or, have had to have surgery, that's when oftentimes a lot of our students are excited about sports medicine. But even if you don't yet know where you want to go in sports, in the field of medicine, the Sports Medicine Institute is a great way just to kind of see what it's like, network and engage with lots of different physicians, and also, students who oftentimes are more excited about the prospect of surgery. This would be a really good institute for them as well.
Yeah, not only will you be learning from surgeons, but you'll also have some of those experiences that are adjacent to surgery in a lot of ways, which includes obviously the cadaver dissection and then the use of the arthroscope and the cadaver experience as well. So some things that are relatively unique to surgery. In addition, during that time, we'll let you practice with suturing, which is something I hadn't mentioned yet and is a very surgical task, but practicing how to, throw a stitch and tie a knot and things that are very surgery focused. So if you're not interested in being a surgeon, there's still a lot to gain from this institute, and we're exposing you to different fields as well. But if you are interested in surgery, it's quite a good one to get involved with.
Yeah, absolutely. All right, we're going to kind of transition into talking a little bit more about the logistics of this institute. So, if students are kind of trying to figure out, like, okay, how can I envision myself um, during this institute? Where does it actually take place? Where
Yeah,
will
so
this
we,
be?
we do have a lot of the experiences taking place in a lecture hall at the medical school. And that just gives us an open space to have our lecture-based discussions and some of our panel discussions. We try to keep it as interactive as possible. There's no tests, it's not a quiz, it's not like we're trying to teach you material that you need to memorize. We're trying to expose you to different areas of sports medicine, and hopefully you learn a lot from it, but also learn a lot about what makes up the profession in terms of the team approach, the physical therapists, the athletic trainers, and really everything that goes into it. But you'll have some experiences, including the panel discussions based out of the lecture halls. And then in addition to that, you'll have external experiences, both in that cadaver lab that I talked about, as well as at the pitching lab. And you certainly won't stay on site at the hospital where we'll be doing a lot of the activities, but you'll stay in the dorms and um, you'll still get that full experience of what Wake Forest Undergraduate University has to offer, even though we're spending a lot of time in the medical center.
One of the other really cool highlights is that students do get to go behind the scenes at Wake Athletics. So one of the days, students will be able to kind of see behind the scenes, go into the practice facilities where the football team trains, go into the training rooms. So that's a really awesome experience as well. That students will be able to kind of visit and engage with those professionals that work in the athletic department at Wake Forest University.
That's a
Um,
great point. I forgot to mention that, but you will get a tour of the athletic facilities, which is interesting to see. And um, athletics now at the Division I level, the facilities are really outstanding, from the weightlifting facilities to the practice fields to the locker rooms and the athletic training facilities as well. And Wake Forest employs a lot of athletic trainers to keep the athletes healthy and on the field, and it's become a big business as well, just keeping those athletes healthy with how NIL has really come about and the athletes getting more compensation and things of that nature. So we really try to keep athletes on the field, both from the surgical and medical side, but also from the athletic training side. And the facilities are a big part of that.
mhm. Yeah, absolutely. So you mentioned that the students will be in the hospital. So this is another logistical question. What do students need to wear each day? How can they be prepared? What do they need to come to the classroom with? Kind of talk me through how students can be prepared in terms of what they need to bring and wear.
Yeah, that's a good point. So as part of this experience, we will mimic one thing that happens in medical school, which is that you get your white coat. And so that white coat will just show everyone in the hospital that you're part of this institute, and it will be labeled as such. And so we will provide you with a white lab jacket that um, will kind of identify you as part of the institute. And as we travel from place to place throughout the hospital, we'll ask that you wear that. In addition, otherwise, it's just semi-professional attire. It can be casual. You don't have to look like you're in a suit and tie, but we do ask you to be professional in a way that you'll be walking around the hospital, around other doctors, around the medical school and medical students and researchers and things of that nature. So, um, not formal, but also respectful of that environment.
Yes, and closed-toed shoes is another big one for a sports medicine
Yeah.
student. Um, how do you think students' experiences in the Sports Medicine Institute might connect with their future careers? And what skills or insights do you think they'll walk away with?
Yeah, it's certainly something that when you look at someone applying for medical school or residency and you look at the total body of work and what they've exposed themselves to, it's something that often will pique your interest or catch your eye that, hey, this person has been interested in devoting time in their summer, even as early as high school, is into sort of learning more about the profession of medicine. And it's not direct clinical hours, but it's certainly a lot of exposure to what we do and the breadth of what we do and the fields that we work in. And so you'll learn a lot about the nuts and bolts of our job, the training required, and some of the conditions that we treat. You'll also get exposure to us and the potential opportunities for future mentorship if you'd like to reach out to us in the future. And students certainly have in the past reached out for additional mentorship beyond the week and even later on in their path as well. And so it's a good exposure to the pre-medical experience in terms of that networking that's required, but also in terms of the just nuts and bolts of what our profession is, what we do, and what our job is like. And learning about that can help you determine if that's right for you or not.
Yeah, one of the biggest goals of the summer immersion program is just to give high school students more clarity and insight about what they may want to pursue. And as Dr. Trasolini mentioned earlier, it's a pretty beautiful thing when you're a high school student and you don't have the pressure of grades or assignments. So this is really just a rich learning experience just for the sake of learning. And so if you are curious or passionate about sports medicine, surgery, any field, as Dr. Trasolini mentioned, in musculoskeletal arenas, then, the Sports Medicine Institute would be fantastic for you. Um, and then Dr. Trasolini, talk to me about the teaching assistants that are able to work and engage with students throughout the week.
Absolutely. So the teaching assistants are a critical part of the program, and for a few reasons. One is they help keep you together and keep you organized and keep you on schedule. They'll help us with icebreakers, help you get to know each other, and really help with making things move along smoothly with the institute throughout the week. So we lean heavily on them for their supervision, their organization, but also their ability to get you out of your shell and participating in the lectures and the discussions and the panels as well. We find that this institute functions best when it's driven by your questions, not just by our comments. And so the more you can stay involved and ask questions and be encouraged to do so, I think that's better.
Yes, absolutely. We're going to transition into learning more about Dr. Trasolini. So, Dr. Trasolini, talk to us about a fun fact or a quirky hobby or hidden talent that might totally surprise the high school students that you'll work with this summer.
I don't have time for quirky hobbies anymore because I have three children, five, three, and one. And so a lot of my hobby time has gone to taking care of them, which is a hobby in and of itself. But one thing that we've really enjoyed about Winston-Salem is sort of immersing in the Wake Forest community. And one of our favorite things to do is to go to baseball games together or go to basketball games together. I have to work all the football games as one of the doctors for the team, so I don't get to do that, but I try to take advantage of the Wake Forest community in other ways. But raising three young children is my hobby for now.
It's a good hobby to have. Okay, we'll transition into the rapid fire questions. So I will say a category, you just name the first thing that comes to mind. So what is your favorite book, Dr. Trasolini?
Dune.
Okay. I have not read the book. I've seen both movies though. It's
Oh yeah, well there you go.
pretty
Book's
good.
better. Always
Yeah.
is.
Favorite movie or TV show?
I was really big on Game of Thrones, and I'm
Mhm.
still trying to get that back. I haven't found another one to replace it yet.
Yeah, it was a good one. What are you currently listening to? Either music, podcasts?
Yeah, there are some really good podcasts in orthopedics, and so I listen to the ASCS podcast a lot, which is the American Shoulder and Elbow Surgeons podcast. It's actually co-hosted by one of my partners, Dr. Brian Waterman, and it's a podcast of international guests talking about shoulder surgery. So that's the nerdier side of it all, but that's the podcast that I would listen to most.
Yes, fun fact about Dr. Waterman, he used to serve as academic leader
Mhm.
for the Sports Medicine Institute. So if any of you are very eager and want to learn more about shoulder surgery, check out Dr. Trasolini's favorite podcast.
Right.
All right. What is your favorite food?
Well, as you could tell by my last name, it's quite Italian, so pretty much any Italian food would do it for me. Any kind of pasta with some good bread and olive oil, that's all I need.
Yeah, it's great. Any pets alongside the three kids?
No, they're enough work and mess themselves, so we don't have any pets right now. And I am
Uh,
allergic to cats and dogs, so that makes it a little bit harder.
yeah. And lastly, what is your favorite place that you've ever traveled?
When I was just finishing college, which is closer to your side of life than me, I did a big trip throughout Europe and we visited a lot of different countries, me and my friends from college, and we kind of backpacked around. But I thought the coolest place that I ever visited there was Switzerland.
Hmm. I've never been to Switzerland, always wanted to go.
It's
Well,
beautiful.
great. Thank
Yeah.
you for sharing all of that. It's always kind of fun to hear, the more the lighter side of our academic
Yeah,
leaders. So thank you for
that's
sharing
for
all of that.
sure.
All right, so we're winding down now, but we'll just kind of finish up with a few more questions about sports medicine.
Sure.
If you had to describe the institute in 3 words, what would they be?
I would say hands-on, multidisciplinary,
Mhm.
and advanced. And by advanced, I mean you're being exposed to things that really wouldn't be things you'd encounter at the high school level. And that would be a human cadaver lab with a real specimen. That would be exposure to an arthroscope and surgical techniques like suturing. That would be the ankle taping and the casting and things that really people would do more on like a collegiate athletic training level or medical school level. And so that's why I would say advanced as well.
Yeah, absolutely. We often brag that, third year school students oftentimes don't get to do some of the simulations and the labs
Yeah.
that our high school students get to do. So it's a gift and a privilege for our high school students that get to engage with these leaders and get to do all these hands-on activities. So that was great.
And it's a
Hands-on,
privilege. It's a, yeah,
multidisciplinary, and
and advanced. And I would say it's a privilege for us too. And one thing that continues to remotivate us is seeing the interest in the students that keep coming along. And so I encourage you, if you are interested, to not keep that to yourself, but express it and come with questions and come really seeking to get as much as you can out of the experience.
yeah, absolutely. That is a good segue into our next question. Finish this sentence. You should experience the Sports Medicine Institute if you're someone who blank.
Has questions about careers in sports medicine, if you're someone who's passionate about injuries and musculoskeletal health, and if you've had any personal experiences with them before that you might be able to use to motivate you into a career in those fields.
Yeah, great. Dr. Trasolini, what is your favorite thing about working with high school students in the Sports Medicine Institute?
Yeah, I think my favorite thing is it sort of reminds me of what I was like at that stage. I wanted this career when I was at that level and a high school student. I was a frequently injured athlete and had a lot of exposure to physical therapy and orthopedics and athletic trainers, and that was my exposure to the field. I would have loved an institute like this when I was in high school, and so that's, I think, part of what continues to drive me to stay involved and why I continue to enjoy it so much.
Awesome. Well, thanks for that. And our last question of our fireside chat, why Wake?
Why Wake? Wake is a beautiful place of the country. It's a beautiful campus. Academically, you'll be challenged, but you won't be overstressed or in an environment that's um, I would say too stressful or too dingy or too busy or too um, unsafe in any way. Wake is a safe community. It's self-contained. It's a beautiful campus, and it's a really nice place to spend 4 years and learn. In addition, there's just so much community here. The people are kind, and the area around Wake Forest continues to grow and develop. There's always new restaurants and shops and areas that are popping up. In particular, right around the Wake Forest University, there's a new walkable shopping and restaurant center that's coming up. I think they're calling it, I forget what they're calling it, the grounds. That's what they're calling it, but right next to the football stadium, and that's a huge investment from the community. But it's a growing area, it's a safe area, it's a great learning environment for college students.
Yeah, awesome. And I will just kind of add on to that. It's pretty rare um, for undergraduate students to be able to have access to such a state-of-the-art medical center and School of Medicine. And the collaboration between the School of Medicine, the medical center, and the undergraduate, college is really, really fantastic. And, Dr. Trasolini recently had an undergraduate student reach out to him about a shadowing opportunity, and we are able to pull him in, and we've hired him as teaching assistant. So it's a really supportive environment where, undergraduate students are able to benefit from the medical center and the individuals who teach at the medical center and kind of practice medicine. So I think it's a really unique opportunity for those interested in pursuing healthcare. Awesome. Well,
Absolutely.
Dr. Trasolini, thank you so much for making the time to have this fireside chat with me. I think it'll be really, really helpful for students and families who are considering the Sports Medicine Institute, or for those who are signed up and ready to come to the Sports Medicine Institute. So thank you so much for your time.
And likewise, thanks for yours.
Awesome. Well, thanks
Bye.
everyone for joining me for this Sports Medicine Institute fireside chat. And until next time, thank you.